Hi everyone, my name is Robyn Cruze and I am the National Eating Disorder Recovery Advocate for Cato House at Integrative Life Centre, and I am also the co-author of Making Peace with Your Plate, Eating Disorder Recovery.
And hi everyone, I'm Bonnie Brennan. I'm the clinical advisor for Integrative Life Center's new eating disorder program, Cato House, and I'm also the founder of Eating Disorder Intervention.
We recently completed a webinar called A Paradigm Shift, a new way to treating eating disorders and substance use concurrently. And we had a lot of questions that at the time we could not answer. So Bonnie and I would like to go ahead and answer those for you now. So Bonnie,
yes,
one of the questions we received is, can you completely heal from an eating disorder?
I love this question, and thank you for putting this first, right? So a lot of people wonder about that. Will I be able to completely recover? What happens if I get stuck in recovery? And the way that I like to answer the question is yes. The challenge for a lot of people is that the content that we have in our brain is always there, Robyn. Like, we can access it. We can access memories and experiences from throughout our lifetime. So what we can't do is take away the information from the brain. It'd be great if we could just kind of go in and extract, okay, how to have an eating disorder. I've taken it out of my brain.
Wouldn't it though?
Right. And so what I want to encourage people is that using that as a barometer for full recovery doesn't work. You're going to have thoughts from time to time. For family members watching this, people might have thoughts. They might have their brain telling them, remember how we used to deal with things with an eating disorder, but it's the consistent choice not to have an eating disorder or the behaviors within the context of already having those thoughts that shows you're on your path well into recovery, right? So just because the thoughts are there doesn't mean that you're not recovered from your eating disorder. And I want to help people not to be so scared about their thoughts. They're just thoughts. You can choose differently. And if you happen to decide to go with the thoughts for one day, that doesn't mean that you're not fully recovered. It's consistent pattern over time of choosing behaviors that are on a path to valued living that gets full recovery.
Thank you, Bonnie. So the next question is, what's the recommended level of expertise to treat eating disorders?
That's another really good question. I think we have credentialing bodies such as the International Association of Eating Disorder Professionals that provide a very clear pathway to call yourself a certified eating disorder specialist. That said, a lot of people maybe have their own life experience, an experience with a family member. When I was first getting into eating disorders, I thought that I could never treat eating disorders because my mother had an eating disorder. So I thought that was the opposite. Even though I had all this life expertise, that I wasn't going to be able to be competent to do it because my mother had an eating disorder and never got recovered from it. The key to expertise in treating the population is really surrounding yourself with other clinicians who do have the expertise. For those who are therapists, please remember that the therapeutic relationship is the most important thing that helps people to get well. And you can certainly build your expertise with another team member, for example, a psychiatrist, physician, dietitian, a family therapist, eating disorder coach, to help you if you happen to have someone struggling with an eating disorder to be able to keep this therapeutic relationship. That said, there are times when it may feel like you're practicing outside of your competence and might want to refer out. And what I would recommend is you touch base with somebody who does have the experience to kind of sort that out. You do a paper consultation or ask somebody for some supervision on the case. Sometimes it can be important to get consultation from a certified eating disorder specialist supervisor in order to be able to continue the care with your case. Or you might even want to decide to pursue credentialing, as I mentioned, with the International Association for Eating Disorder Professionals. There's also some other places to look for gaining expertise in eating disorders. For example, I do some volunteer work with the Eating Disorder Foundation, and they will take on interns that help to, I've had several interns help me run my group. There's the Academy for Eating Disorders and the Alliance for Eating Disorder Awareness are also places that you could go to start, like, is this something I'm interested in? And maybe spend some time in volunteering too to see if the population is a fit for you.
That's beautiful. Thank you so much, Bonnie. And I know that a lot of the people that see this treat substance use disorder, and that's their expertise. And so I wonder if you want to talk about the importance of reviewing the differences of treatment for those who have substance use disorder and those who have eating disorders.
Sure, I'll take a stab at that, Robyn. Thank you. Yeah, so first I want to say about, and this might tie into one of our other questions too, that from in the lens that I see it from, and I started as an addictions professional and then moved into eating disorder treatment and focusing, and I've always loved the combination of both. And what both of the disorders have in common is they have a behavioral coping mechanism. So what you do with the substance or what you do with food in your body as a way to help the nervous system or the emotional system or the inside thoughts and feelings to be doused or simmer down. In internal family systems therapy, we call this a firefighting response, so that the system isn't overwhelmed. Now, there are consequences to engaging in substance use and eating disorder behaviors, but in the moment, it feels like I will do anything to not to have this experience that I have inside of myself, if that makes sense. So that's how they're similar. The ways that they're different is, a big one is for folks with eating disorders, you can't take away food and body. So we can't have an abstinence model. And in essence, for those of you who are aware of what it's like to work with somebody with a harm reduction model, that's kind of how we have to do eating disorder treatment, right? Because the thing that the person is recovering in, the environment, food in their body, has to be with them all the time. It would be akin to taking the alcoholic into a bar and saying, we're going to teach you how to have a healthy relationship with this bottle of Jack Daniels in front of you, right? That's what we have to do in eating disorder treatment. So we have to have a lot of patience and a lot of time spent with the individual as they get exposed to food experiences, exposed to their body feeling a different way, and continuing to make the choices into their life that helps them to have a context of why to do all of this hard work of recovery. Why do I keep feeding myself and not getting rid of it? Or why should I tolerate being in this body as it changes if I weight restore or get more nutritionally stable? Also, I think it's important to know that the difference is that there are temperament differences with eating disorders and substance use. Folks with eating disorders have tend to, you can check this out in the webinar, tend to have more of a harm avoidant temperament, meaning they don't want to get in trouble and they want to do things very safe and keep things on the up and up and pay attention to the details, where folks with substance use will tend to have more of a high novelty seeking. They tend to be more impulsive, want to try new things, could be quick to anger, maybe creative and more sociable. And those are just broad brush strokes about thinking about how they're different. But there are a lot of individuals with both, right? We have 27% of anorexics who have a substance use disorder, 23% of binge eating disorder, and 37% of people with bulimia nervosa will have both. So it's good for us to find integrated models to be able to treat them together.
Yeah, thank you so much, Bonnie. A question came up about what is the relationship between trauma and eating disorders?
Great. So that kind of goes back to what I was saying before. So when we have trauma, and it's really defined as, from the individual's perspective, I'm talking about trauma from the individual's perspective, not necessarily a strict DSM diagnosis of PTSD. So trauma could be things like bullying or being in a family system, or simply being in a family system where there's a temperament mismatch. When things don't seem to be firing on the same levels because one person temperamentally is very different than another, the experience of the child can feel invalidating, even if the intent of the parent is not there to hurt them and the caregiving is solid. So then in terms of what I'm thinking about with trauma and eating disorders, that's kind of my definition. It's anything that activates the individual as a wound, usually from previous experiences of life. And then the individual adapts how they behave in certain situations in order to protect that wound, to push it aside, to be able to fit into a certain social group, something like that. Mm-hmm. So eating disorders can develop from all kinds of situations, right? It can start with a simple diet. It can be a way to just kind of try to live life more healthy, for example. But a lot of times what we find is that what maintains an eating disorder is wanting to avoid the internal experience from traumatic situations or traumatic wounds that have happened to them. And when those experiences get triggered, eating disorder behaviors come in to help douse the pain of that wound or keep it out of awareness. People who have been in their eating disorder for a while will tell you that I don't feel anything from below my head. I have a lot of thoughts and sensations, but it's hard for me to feel even good feelings like love and joy, because when we try to cut off our awareness of emotions, we can't just pick the bad ones. The good ones get cut off too. So it's very related in terms of if we don't also try to heal the wound and we just treat the eating disorder, something else might come up, or it's going to be tempting for the eating disorder to come back in to soothe the wound. So again, I advocate for we've got to pay attention to it all, because it's not just how to not have an eating disorder is how we're helping somebody, is how to be able to have your own internal experience and choose the life of recovery.
Yeah, I love that. I always think about the quote from Gabor Mate. He says, the question is not why the addiction, the question is why the pain.
Right, exactly.
Yeah, I love that.
I love that.
Okay, so the last question is somebody wanting to know how to speak to somebody that they think may have an eating disorder. So they're asking, what is the biggest sign of an eating disorder?
Well, there's a lot of different signs of eating disorders, and people do different things with food in their body. I just love helping this population because everybody is so different, right? And I get to learn new things about the way that people have their story and what they do about their food and their body. Everyone's such a unique individual who has struggles with eating disorders and substance use. But so the things that you're on the lookout for, though, could be obvious things, like the person looks like something's wrong. We can visually see that, their skin might have a pallor to it that is kind of grayish, or for some people, they grow fuzz on their face. Lanugo is what that's called, as it bodies attempt to keep it warm. You might notice hair falling out. You might notice for people who engage in self-induced vomiting, they might have scarring on their knuckles from putting their fingers down their throat. So there's appearance things. And some people will either want to cover up their bodies with wearing big, baggy, loose clothing, or some people will actually show you, look how bony I am. We call it bone showing. So those are some ways that you can spot it. But for a lot of people with eating disorders, they don't look like an anorexic would look, right? So the majority of people who have eating disorders don't fit that profile. So what are some of the other ways that we can tell? Well, one would be isolating oneself from social events, especially around things that involve food. A lot of talk that has specific focus on like food, what type of food is good, what type of food is bad, measurements about food. If you notice it's hard for your loved one to actually have a conversation with you without saying words about food in their body, that's a red flag that there might be an eating disorder there. Behaviors such as getting up from the table right away and using the bathroom after a meal, excessive exercise, like not making it to certain important commitments because you need to take that 20-mile bike ride before you go to the family wedding or something like that. That could be a sign. Finding food hidden in the room or in special places, like food hoarding behaviors. Also, some individuals might notice in their home that food disappears, and it might not be the food that you would think people would want to eat, but sometimes people who struggle with binging and purging disorders will go eat anything because it's really about getting something in to be able to get rid of it, for those who struggle with purging especially. What are some that are coming to mind for you, Robyn?
Oh, I think getting up at the table was a really good one. I think the over exercising, the more than 3 hours a day, when you see that, or if somebody has hurt themselves but still insists on going and exercising, that's a red flag. I would love to say that we have a free downloadable ebook that you will find in the links below that will have many signs and symptoms, including ways that you can speak to your loved one who you feel may possibly have an eating disorder.
I'll just say one more thing about that, speaking or not speaking, because a lot of people ask me that question. So my answer to that is weigh your option. You might be saving a life by gently talking to your loved one or your friend, versus what a lot of people are afraid of is like, maybe I insult them or maybe they get mad at me. So that might be 45 minutes of uncomfortable emotional response for both of you versus this is the conversation that person needed to hear. And from the folks that I support in my support group that I run for individuals who are 50 and over still struggling with their eating disorders, they've told me to tell you, say something, do something.
Oh, I love that. That's really freaking awesome. That's amazing. Thank you, everyone. If you would like to view the webinar, please have a look at the link below and you will find it there. Thank you so much for all you do in your communities to help people heal.